Thanks for staying with us. It's a race against time in the Central African Republic, which is currently dealing with a cholera outbreak. The government says the outbreak, which was declared earlier this month, has infected more than 150 people and killed at least 18 people so far.
Latest figures from the government states that more than 150 people have been infected with cholera and at least 18 of them have died from the disease. I am very worried because we have been conducting awareness programs on the radio, and as a mother I have many children at home and there are many children in my neighborhood. We have bad roads, so when it rains the water stagnates in all the neighborhoods. I want to ask the government to take responsibility as our government, otherwise we will all contract cholera. Medical charity Médecins Sans Frontières has opened a cholera treatment center in Bangui, and the International Organization for Migration is supporting an awareness campaign along the country's entire southern border. MSF is also monitoring communities along the Bangui River who use it as their main water source and have said it was working to prevent the river from spreading the epidemic further.
According to the numbers that we have from different villages, this is the biggest cholera epidemic in the country. And according to our information, the villages of Juku all the way to Kembe have the majority of cholera cases. We have also seen sporadic cases in Bangui, although we are still evaluating that information.
Cholera, which spreads through contaminated food and drinking water, causes diarrhea, nausea and vomiting. The disease can lead to death by dehydration and kidney failure within hours if left untreated, but most patients recover if treated promptly with oral dehydration salts. The International Organization for Migration, IOM, said it was concerned about the risk of the cholera outbreak spreading throughout the capital's 26 sites for people uprooted by fighting, which hosts some 50,000 displaced people. Aid agencies said early action to prevent a further spread of the disease was necessary, but also acknowledged that water and sanitation programs were hugely underfunded. The UN Children's Agency UNICEF said it was working with the Health Ministry to supply medicine, clean water, purification tablets and hygiene kits to cholera-hit communities.
It is a worrisome phenomenon because there are many African countries that are facing the cholera epidemic. The statistics that we have obtained at the end of the month of May in Africa show that more than 29,000 cases and more than 500 deaths, which is quite high. The countries that are greatly affected by this are those in the Central Africa, including DRC, but also countries in East Africa like Tanzania and Kenya, which have also reported cholera cases.
The Central African Republic was last hit by cholera in 2011 when an epidemic swept through West and Central Africa, one of the biggest in the region's history, infecting more than 85,000 people and killing at least 2,400.
Over now to South Africa, where there's been a change in health policy, especially as it concerns those who have tested positive to HIV. The government says from now on, patients will have access to antiretroviral treatment from the state before they get ill. A World Health Organization study has found that treating anyone who's HIV positive as early as possible helps improve their health and prolongs their life. South Africa currently has nearly 4 million people living with HIV, but who are not on medication. The country has a current life expectancy of 63 years, but has the largest free HIV treatment program in the world. And that's it on the program today. Thank you so much for watching. I am BC Adebayo.